Irritable bowel syndrome, IBS, is a common gastrointestinal (GI) disorder that affects the large intestine, also known as the colon. It is a chronic condition marked by a group of symptoms that occur together, including abdominal pain, bloating, and changes in bowel habits. IBS does not cause permanent damage to the intestines or increase the risk of more serious gastrointestinal diseases like cancer, but it can significantly impact the quality of life for those who suffer from it. Types of IBS. IBS is classified into 4 main types based on the predominant bowel movement pattern. IBS with constipation, IBS-C hard or lumpy stools at least 25% of the time, and loose or watery stools less than 25% of the time. IBS with diarrhea, IBS-D loose or watery stools at least 25% of the time, and hard or lumpy stools less than 25% of the time. IBS with mixed bowel habits, IBS-M both constipation and diarrhea are present more than 25% of the time. IBS unclassified, IBS-U symptoms do not fit neatly into the other categories. Symptoms. The symptoms of IBS vary from person to person but generally include abdominal pain or cramping, often relieved by a bowel movement. Bloating and gas. Diarrhea, constipation, or alternating between the two. Mucus in the stool. A feeling of incomplete bowel evacuation. Symptoms can be triggered by stress, hormonal changes, certain foods, and even changes in routine. Symptoms often come and go and can range from mild to severe. Causes and risk factors. The exact cause of IBS is not well understood, but several factors are believed to play a role. Abnormal GI motility, the muscles in the intestines may contract too strongly or too weakly, affecting how food moves through the digestive tract. Visceral hypersensitivity, people with IBS often have a heightened sensitivity to abdominal pain and discomfort. Gut-brain interaction, disruptions in the communication between the brain and the digestive system can affect bowel function. Infections, some people develop IBS after a severe bout of gastroenteritis, a stomach bug, known as post-infectious IBS. Changes in gut microbiome, an imbalance in the intestinal bacteria may contribute to IBS symptoms. Risk factors for IBS include being under the age of 50, being female, due to hormonal differences, a family history of IBS, and having a history of stress, anxiety, or depression. Diagnosis. There is no definitive test for IBS. Diagnosis is usually made based on medical history, symptom patterns, and the exclusion of other conditions. Doctors often use the Rome-4 criteria, which includes recurrent abdominal pain on average at least 1 day per week in the last 3 months. Associated with 2 or more of the following. Related to defecation. Change in stool frequency. Change in stool form, appearance. Additional tests such as blood tests, stool studies, and colonoscopies may be ordered to rule out conditions like celiac disease, inflammatory bowel disease, IBD, or colon cancer. Treatment and management. Although IBS has no cure, its symptoms can often be managed effectively with a combination of dietary changes, medications, and stress reduction. 1. Dietary changes. Low FODMAP diet. This involves avoiding foods that are high in fermentable carbohydrates, which can cause gas and bloating. Fiber intake. Soluble fiber supplements can help relieve constipation. Avoiding trigger foods. These can include caffeine, alcohol, spicy foods, and artificial sweeteners. 2. Medications. Antispasmodics, help reduce abdominal cramping. Laxatives, used for IBS-C. Antidiarrheal medications, like loperamide, used for IBS-D. Antidepressants, low-dose tricyclic antidepressants or SSRIs can help relieve pain and manage anxiety or depression. Probiotics, may improve symptoms for some individuals. 3. Stress management. Stress can greatly influence IBS symptoms. Techniques such as yoga, meditation, cognitive behavioral therapy, CBT, and regular exercise are often recommended. Living with IBS. IBS is a chronic condition, meaning it can persist for years or even a lifetime. However, many people learn to manage their symptoms effectively with lifestyle changes and support. The unpredictable nature of IBS symptoms can sometimes affect work, travel, and social activities, leading to emotional distress. This makes mental health care an important component of IBS management. Support groups and counseling can be beneficial. Keeping a food and symptom diary helps in identifying triggers and understanding personal patterns, which can lead to better symptom control. Conclusion. Irritable bowel syndrome is a complex, multifactorial disorder that affects millions of people worldwide. While it doesn't lead to serious physical damage, it can severely affect one's quality of life. Understanding the symptoms, triggers, and management strategies can empower individuals to take control of their health. With the right combination of dietary modifications, stress reduction techniques, and medical treatments, most people with IBS can find relief and live a normal, fulfilling life.